Welcome to the Trinity Health IHA Medical Group Wednesday Wellness Series. This presentation is titled Lifestyle Changes for a Healthy Heart, and our presenting providers are cardiologists Paul Nona and Frank Smith. They'll be presenting tonight with registered dietitians Jessica Helmick, Megan Sabourin, and yoga therapist Jennifer Lenders, who are all part of the Trinity Health Ann Arbor Intensive Cardiac Rehab Program. Welcome.
I'm Dr. Frank Smith, as Allison said, Medical Director of the Intensive Cardiac Rehab Program at Trinity Health, and my colleague, Dr. Paul Nona, and I will be answering questions, I think at the end of all the presentations, probably not right at the end of each one. So I'm going to start by sharing my screen here, and hope everybody can see that, I hope.
Yes, looks good.
Does it look good? Okay. I guess I'll go here to this. That still looks good, I hope. Okay. All right. I'm going to talk briefly, a brief overview of lifestyle changes that can help you not only prevent heart disease, but if you happen to have heart disease, unfortunately, be able to treat it as well. So what is lifestyle medicine? So let's just talk about that for a minute. The definition is up there. Basically is a therapeutic intervention, and it includes a number of components that are there in purple: whole food, plant-based diet, regular physical activity, sleep, stress management, avoidance of risky substances, and positive social connections. These combinations are not only used to treat, but as it states there, also to prevent and often even reverse chronic disease. So this is not just a treatment program. This is actually a preventative program or even a disease reversal program. So even if you have disease, it's not too late. So lifestyle changes are about the best thing we have to help your heart. We have lots of other things, which I won't go into, of course, but if you were to just pick out one intervention that would be best for you to do for yourself, it would be to adopt these lifestyle changes. And you're in charge, and there's no extra cost or side effects. This is something I think you've all probably seen. It shows causes of death in the United States. It's an interesting diagram to me, but really leaves me kind of frustrated because it doesn't really help me talk to patients about anything. Basically, what it tells me is I should tell the patients not to get heart disease, not to have cancer, not to get COVID, don't have any accidents, and don't have a stroke. Well, that's great advice, but not terribly actionable in terms of what you can do to help yourself. A better way to look at it is conditions that cause death in the United States. This is just kind of flipping it around a little bit. And you can see there's what, 8 of them there, and that at least 7 out of 8 of them are lifestyle related. And in fact, actually about 80% of the conditions that are seen by primary care docs are lifestyle related conditions. So there's plenty of room for these types of measures to help you improve. These are the 6 things I mentioned earlier. You can read them there. And this is from the American College of Lifestyle Medicine. This is a medical subspecialty like cardiology or like OB-GYN or like, something of that nature, where you actually take board exams and are board certified. So this is a legitimate specialty that practitioners are now engaging in helping people make these changes. I think every doctor should probably be a lifestyle medicine doctor, but these are specialists in that area. And we have a number of these at St. Joe's and Trinity Health. So the 3 components that we use in intensive cardiac rehab are not terribly different than those 6 pillars that I showed earlier. They're exercise, nutrition, and mindfulness. So we kind of follow along with this through our ICR, our intensive cardiac rehab program. So let's look at some of these. In the interest of time, I'm not going to spend a lot of time talking about number 5, risky substances. We could go into that, but basically, overwhelmingly, the advice there is don't smoke. If we have time in the questions, I can talk more about alcohol and other things if you wish, but I'm going to go over the others in a brief overview. So let's talk about healthful eating first. And in America, we clearly have a nutrition problem. This is a graph of the obesity rates in the United States from 1991 to 2020. The dark red is greater than 40% of the population obese, and you can see what's happened down in 2020, including Michigan. The national average right now, I believe, is about 43% of Americans are overweight or obese. So we clearly have a problem there. And we could try to alter it by things like this. This is kind of a graph on the left side of what you put into your body, and on the right side, what kind of happens. And while, again, this is interesting, if you're a research specialist or something, it doesn't really help much in terms of any of us making actionable changes in our life. So we got to simplify this down a bit. We could use this approach where you take things that are benefit and blue in the top, and take things that are harm in the bottom, and do more of the blue and less of the red. But still a little complicated. Doesn't really help. You get focused on individual items here and kind of lose track of the forest for the trees. A better way to do it is focus on a food-based diet pattern. What I mean by that is a whole way of eating. So on the top here is an isolated nutrient, namely fat. And you can see what happens here over the years in terms of the risk of getting coronary disease. It's not much different than usual care. But if you look on the bottom, this is a diet. This happens to be the Mediterranean diet. And you can see, if you look over the same 5 years, how much lower rate of cardiovascular disease there is when you follow a food-based dietary pattern. I might ask, well, what food-based dietary pattern? Believe it or not, U.S. News and World Report has U.S. News and World Report diet or something like that. If you want to get to that website, you don't have to write that down. Has every year they look at the top 42 diets, and they rank them in terms of best overall and best heart health. And these are the current rankings from this year. Mediterranean diet best, DASH diet second, and so-called Mind diet third. I'm not going to get into all of these except to say that they are dietary patterns. And when you click on the read more part on this, you can find all sorts of additional information on that. So use this as a resource. The bottom line is that you need a whole food, plant-based approach. That means it should be whole foods, not processed foods. Apples, not apple Pop-Tarts, for example. And it should be plant-based. It doesn't mean you have to absolutely be a vegan, but at least emphasize plant-based foods. And this is what happens when you do that. We can just look at the left graph there. This is your bad cholesterol. In the red and blue are either taking a statin or starting a whole food plant-based diet. And you can see that both of those overlap in terms of dropping your bad cholesterol pretty quickly, within 2 weeks, actually, of starting this. And you get about the same effect from a diet drop as you do from a statin drop, whereas the so-called low-fat diet, which is again an isolated nutrient, doesn't do much of anything. It also reduces inflammation in the same rate, in the same fashion. This busy chart here, just look at the left side here. This is death from any cause by using a Mediterranean diet, 25% reduction, death from coronary heart disease, 33%, and even death from cancer, 24%. So you get a pretty massive drop in your risk by adopting one of these kinds of diets. I only put this in just as a kind of an extra slide here. Don't skip breakfast. If you look on the top, cardiovascular disease, and the red arrow pointing to those who never have breakfast, it gives them an 87% increase in cardiovascular disease. If you look down at the bottom in stroke, it's astronomical increase of almost 340% in your risk of stroke by not having breakfast. So eat breakfast. This is our former president of the American College of Cardiology, with his comments regarding cardiologists. There are two kinds of cardiologists: vegans and those who have not read the data. Hopefully most of the cardiologists that I work with are in the first category. Physical activity, similar issues in America these days. This is one of my favorite slides. It's American College of Cardiology meeting a couple of years ago, and there's an exhibition hall at the bottom, and these people are leaving the exhibition hall to attend other sessions. And on the left is the escalator, and on the right is the stairway. And I guess you can probably draw your own conclusions from that. So what happens with exercise? What are the benefits? Well, it relaxes and opens arteries. All your risk factors improve with exercise. Everything listed there. It also has some anti-inflammatory actions. And I'd just like to digress for a minute. We used to think of coronary disease as kind of sludge plugging the artery, which to a certain extent is still true. But a lot of the more recent research says it's not just about cholesterol, it's about inflammation. And anything that decreases inflammation is going to reduce your chances of getting coronary disease. And so anything that we can do in the way of diet or exercise to reduce that is important. And both exercise and diet reduce inflammation substantially. Other things that you can see there from exercise in terms of reducing rhythm problems and decreasing risk of blood clots as well. This is a simple example of people, this is done at Mayo Clinic a number of years ago, who did cardiac rehab. So they spent 12 weeks in cardiac rehab. Then they followed them for 10 years on the left side there. And this is a chance of patients that were still alive after that time period. You can see if they didn't do cardiac rehab, about 30% of them were still alive. And if they did do cardiac rehab, about 80% are alive. And the right side just shows it didn't make any difference whether you were old or young, man or woman, smoker, non-smoker, obese or non-obese, whatever. It applied to all people. So clearly there's something going on here with exercise that improves your long-term prognosis. This is graph of exercise with fitness levels from low on the left, number one, to high levels on the right. The red is men, the green is women. And what I guess I want you to notice is it's pretty obvious that the more activity you do, the lower your risk is of death. But notice how quickly the risk drops. Just going from level 1 to level 2 drops your risk substantially. So that tells you don't have to do a lot to drop your risk. And here's another way of looking at it. This is all women, Women's Health Initiative. And this is vigorous exercise on the left and just simply walking. And notice that the bar graphs from going low in 1 to high in 5 are kind of the same shape. So you almost get the same effect from walking as you do from vigorous exercise. So the moral of the story is that any amount of physical activity yields health benefits and is better than none. Just standing 2 hours a day will drop your risk by 10%. And then, of course, the more you stand and the more activity you use, as you can see, the lower your risk is. So let's jump to sleep here for a minute. These are things you don't want to have happen, all these dot points, and lack of sleep pretty much does all that to you. It raises your blood pressure, it causes heart rhythm irregularities, your arteries get stiffer, you don't get good repair of the artery, you get damage to your coronary circulation, you get could get diabetes, you get a weight increase, and you get inflammation, as I said, with increased blood clotting. So if you can think of a worse recipe for yourself, that's what you're doing to yourself when you don't get good sleep. How much is good sleep? Look at the top graph there. It's just basically the little green dots are good sleep quality, and the little red dots on the top are poor sleep quality. And you can see that the lowest risk, the risk increases in the direction of the black arrow. The lowest risk is at about 7 hours of good sleep quality and about 8 hours of poor sleep quality. So it appears that 7 to 8 hours are probably optimal as far as the best sleep quality. We do an experiment twice a year on sleep deprivation. It's called daylight savings time. And as you know, in the spring on the top, you lose an hour of sleep. So look what happens. That's usually Sunday morning at 2 a.m., I guess. And by Monday, you got a 24%, almost 25% increase in heart attacks occurring when you lose 1 hour of sleep in the population. Conversely, in the fall, where you gain an hour of sleep at the bottom, you get about a 21% decrease in heart attacks. So that's 1 hour of sleep for one day changes the population health in that fashion. So you can see how powerful that is. So here are some quick suggestions taken from this book in the lower right. It's one of my favorite books. Matthew Walker is an extraordinary writer. He's a sleep researcher. He writes in a very entertaining fashion. It's a super easy read, and I highly recommend it. Some of his recommendations are listed there. Same sleep schedule, keep the bedroom dark and free of screens meaning computers and television. Avoid late in the day caffeine, nicotine, and alcohol. And if you want to reset your sleep clock, the best way to do it is to get some bright light therapy, bright sun, light therapy lamp in the early morning, and then try to do something relaxing, power down before bedtime. Don't stay on your phone right up to the time when you try to fall asleep. And take a look at his book. Lastly, I'm just going to talk about some stress and healthy relationship effects in terms of lifestyle changes. Depression is tough. If you've had a heart attack, you're going to have about almost a 40% up to 40% chance of having the patient be depressed. 25% of a major depressive. This is kind of episode that you use medicines or shock therapy or whatever for to try to treat. So it's major issue. If you don't treat that, about 70% in 1 year are still going to be, the patients are still going to be depressed, and increase the risk of mortality after they've had a heart attack by 4 to 6 times. So this was a study that kind of showed that. They looked at a bunch of patients that enrolled in cardiac rehab over a 5-year period, and they found that the people that were depressed that completed cardiac rehab had a 73% lower risk of depression. But if you were depressed and remained depressed after cardiac rehab, you had a 4 times greater mortality. The graphs are here. So the left graph shows the change in depression before and after cardiac rehab. You can see how much it went down. And the right graph shows that if you were still depressed, that was your mortality versus those people that were non-depressed. Why? Probably because treatment of depression gives less destruction of cells, increased enlargement of the arteries for better blood supply to the organs, and once again, I hate to keep bringing it up, but less inflammation. This is an example of what we do in intensive cardiac rehab. We do regular cardiac rehab, but we add some stress management. And this was an example of a group that had either just plain old cardiac rehab or cardiac rehab with stress management, or no cardiac rehab, and it looked at the percent that were free from any clinical event over 5 years. You can see the green at the top is with cardiac rehab and stress management. About 80% were free of any events. Cardiac rehab alone, about 60% were free of any events, and no cardiac rehab, about only 40% were free of any events. So clearly adding some stress management helps what we do in regular exercise cardiac rehab. This is just simply showing social support on the left and social isolation on the right. The red graph is those who don't have social support or are socially isolated. And you can see what happens to them over 6 years in terms of getting into issues with cardiovascular disease versus those who are socially supported in the dotted line or are not socially isolated. And you can read the figures there at the bottom. So once again, that is very helpful in your lifestyle. Spirituality, defined with the definition at the bottom, may be religious, may be philosophical, may be meditative, gives increased quality of life, increased medication adherence, decreased anxiety and depression, and less hospitalization. So clearly having a spiritual framework in your life of whatever works for you is official. We're going to hear a little bit about yoga in just a bit from Jennifer. And yoga does all these good things. Again, good things that you would like to do. If you feel you're comfortable using yoga in your life, I would highly recommend it. It does all these good things for your body, your cholesterol, your heart rate, your depression and anxiety, and quality of life. And lastly, I have to put in a plug for dog therapy. Owning a pet, particularly this study was done with dogs, gives you just owning a pet, gives you a 24% reduction in death and a 31% reduction in cardiovascular death. The mechanisms are probably in the lower right there, probably increased physical activity, time spent outdoors, social interaction. But in any event, it works. It does. There's a study done with cats too, so they does seem to work with cats as well. So you can go that way as well. So my summary, my recommendations as a lifestyle medicine cardiologist would be to aim toward adoption of a whole food plant-based diet. Do exercise, any amount is helpful, any amount. And don't worry if it's low to start with. Just start. Learn about and try suggestions for better sleep. Don't smoke. Stress reduction, social relationships and spirituality, and think about some pets. So this is one of our colleagues, is a lifestyle medicine pioneer, and this is how he feels about our current treatments. And I'm a former interventional cardiologist. That means I did stents and angioplasties and balloons and stuff like that. And those are very helpful in the right situations, especially in the emergency situations. But they don't really treat the underlying cause. Rather, if you have lifestyle changes, they're the single best medicine for your heart. Once again, you're in charge, and there's no extra costs or side effects. I think we'd have Allison put this in the material, so don't rush to try to write all this down. But if you're looking for preventative cardiology consultation, there's a link there. If you're looking for intensive cardiac rehab information, there's a link there. If you're looking for lifestyle medicine, just resources to read about, that's the American College of Lifestyle Medicine website for patient resources. And if you want a formal lifestyle medicine consultation, there are, gosh, what is it now, 7 lifestyle medicine providers that will do consults for you, see you as a patient, and go over things with you. So those are the links, and we'll get those for you. I'm going to stop there. We're not going to do questions right now because I think we want to save them for the end. And I think we're going to move along now to our dietary presentation. I'm going to stop sharing this so others can take over.
All right. Thank you, Dr. Smith. I'm going to start sharing my screen now. My name is Megan Sabourin. I am the registered dietitian at the cardiac rehab location located at Trinity Health Ann Arbor campus. And I'm going to start sharing my screen and show you guys a presentation that we did behind the scenes. And so start doing it.
Hi, everyone. We are the registered dietitians here at Trinity Ann Arbor. This is our intensive cardiac rehab kitchen that we are coming to you from today. And my name is Jessica Helmick.
And my name is Megan Sabourin.
And we are going to introduce you to a really wonderful recipe that we love here, and we think you at home will love it as well. We really want to try to focus on the benefits of heart-healthy eating today. So we are going to go into a little more detail about how we do that, and this recipe is a perfect example for how we can do that in our everyday eating habits. So to get started, we are going to talk about some of the ingredients that we have here. The first one, I want to, kind of the star of the show, I guess, here is our quinoa. So our recipe is called black bean and quinoa salad with citrus dressing. So quinoa is definitely one of these main ingredients that we are focusing on today with this recipe. This is our tri-colored option of quinoa that you can find at the grocery store. It is typically known to be gluten-free, so if you needed that option, it is a great option for that as a whole grain. But it is important to check the label just to make sure that it is gluten-free and it's processed, making sure there's no cross-contamination happening in the processing of the quinoa. So quinoa is technically considered a seed, but we treat it as a whole grain when it comes to our meal planning here with our nutrition. Quinoa has a rich amount of plant protein, a rich amount of fiber. It also has all 9 essential amino acids, so a really overall superfood, as you may have heard of it before. So it does come in the tri-colored option as we're using today. It also comes in a white option. So the tri-colored option adds more color to the dish, and it keeps a little bit more of that texture as it cooks. It cooks up very quickly, so quinoa is not hard to cook at all. You just usually measure out how much you're going to need with the ratio of water, and you bring it to a boil. And then once it absorbs all of that water, fluff it with a fork, and it's ready to go. It only takes about 12 to 15 minutes to simmer, so it's a pretty quick cooking grain and very versatile. You can use it in place of brown rice. If you have a recipe that you use brown rice, quinoa is a great substitution for brown rice. So a lot of the time we want to encourage our plant proteins when it comes to heart-healthy eating. So more focusing on, plant proteins versus animal proteins. And the reason for that is with plant proteins, we get little to no saturated fat content, which is the type of fat that can clog your arteries. We also get no cholesterol with our plant proteins. but we get a lot of fiber, which is something that we actually do not get with our animal protein sources. So really important that, you know, we're trying to increase these sources of fiber wherever possible in our diet, especially sources of soluble fiber. Soluble fiber is the fiber known to help lower bad cholesterol levels, or specifically our LDL level. So very important. So we get fiber from our quinoa, as I mentioned. We're also going to get a great source of fiber from our black beans. So we are shooting for about 25 to 35 grams of fiber a day. So in order to do that, we really need to make sure that we're getting multiple sources of fiber. And these are two right here from our dish, along with our vegetables that are and our fruit, which are gonna give us some great sources of fiber as well. When we're choosing our beans, if you do end up, you know, choosing canned beans at the store, it's really important to look for the options that say no salt added. So a lot of times you're gonna find many brands of your beans at the store have this option of no salt added. Very important to keep that nice and low. With heart health, we are shooting for less than 1,500 milligrams of sodium a day. So, you know, it can be hard to do, but by choosing no salt added options, it can make it a lot easier. There is a way to reduce sodium in your canned vegetables and canned beans. Besides looking for the no salt added, you can always drain and rinse in a colander or a strainer. If you rinse under cold water for 30 seconds, you actually get rid of some of the sodium that you find from your canned beans. So that can be another really good way to practice some heart healthy dietary changes, is making sure you're rinsing off those beans really well. Next, we're gonna add in some orange segments. So what we did, we took a nice navel orange, we peeled off or cut off the outer rind area, and then we cut it into smaller segments. So that's gonna be the part of our salad today that is gonna give us that sweet part of that sweet and savory mix that we're gonna get from the salad. So it's really good. If you decide at home that you don't want to do that much cutting, or it just seems a little bit too much to you, you can find mandarin oranges canned at the grocery store. We do recommend that you get them in their own juice, they're packed in their own juice, or packed in 100% fruit juice. Very important to try to avoid any added sugars from our canned fruit. So that's the way that we can do that. Next, we're gonna add our red bell pepper. So you can use different colors if you want to. It doesn't have to be the red bell pepper if you prefer orange or yellow. We do get a wonderful amount of vitamin C from our red and orange and yellow vegetables, or even fruits, as we found with our oranges here. So our oranges and our red bell pepper really work together in this dish to provide a great source of vitamin C, which is really gonna help us absorb that iron that we're getting from our beans. So very important that we have that vitamin C within our dishes, plus it gives us such great color and variety. Really colorful dish, actually, when it comes all together. So, all right, and then we also are gonna add our corn kernels. So we have corn that we're using today. Corn is another source of whole grain, and it does have a good amount of fiber. So it can be a wonderful addition actually to our salad today. We are using frozen corn, which is a great option for heart health. If you decide that you want to use canned corn, we do recommend that you, again, look for that no salt added option to keep that sodium low. Very important in any of our canned goods. With canned corn though, you can do the same thing like you would do for your canned beans, and that would be to drain and rinse for 30 seconds. That gets rid of some of the sodium from the can, but the no salt added is going to be your best option. Okay, so now we're on to our red onion. We have diced red onion here that we're adding to our salad. Gives a really great flavor. Onion helps with flavor, so if you like onion, it can be a different type. It doesn't have to be red onion. You can use yellow onion, Vidalia onions, you know, whatever you like, but it's gonna give a lot of flavor. And again, with the red onion, we get more color with it too, which is wonderful. To add to that flavor, we're gonna add a pinch of our ground black pepper. And then we're also going to add a tablespoon of our fresh cilantro. So our cilantro is a nice fresh herb that you can use at home Typically, we find it with more Mexican cuisine dishes. It's often found in things like salsa. Sometimes people do not like cilantro. Sometimes they do. Oftentimes you may run into someone who says that cilantro tastes like soap, and there actually is a gene that some people have that makes cilantro taste like soap to them. So if that is the case with you or someone you know that you're making the dish for, you can always substitute fresh parsley or another fresh herb that you prefer. Now that we have our salad made here, if you can see, it's really colorful, really coming together, kind of hits all those points when it comes to complete nutrition, which is what we want. We want to see all of the complex carbohydrate, plant protein, vegetables in there, very colorful. We're going to start on the dressing portion. So this is our citrus dressing that we mentioned before that goes really well with this salad. And this is our rice wine vinegar dressing. It's very important to find it unseasoned at the grocery store. If it's seasoned, it's going to have a lot of sodium content. So we want to make sure we're getting the unseasoned option. We are going to be using stone ground mustard today. This is also no salt added stone ground mustard. And very important with condiments to be checking that label and making sure that we're keeping that sodium nice and low. Those condiments can pack a lot of sodium, excuse me. Next, we're going to be adding our apple juice concentrate. So apple juice concentrate is something that we use in cooking school to add a nice sweetness to the recipe in a more natural form. So this is 100% apple juice concentrate. And we use it in small amounts. So we have a teaspoon that we're using today. And again, it just gives a little bit of sweetness in a natural form. And next we're going to add our dried oregano. So dried oregano is a very versatile herb. You can use this herb in many different dishes, and it really goes well with playing off of that savory and sweet combination in our salad today. So we'll kind of mix those ingredients all together into our mason jar. We are making our dressing in a mason jar today, which is a wonderful way to make your salad dressings at home if you choose. If you make it in a bowl, it is important to mix it up with a whisk or even with a fork. By doing that, it helps break down the more dense ingredients that we have in there, like the mustard, kind of mixes it up and breaks it down a little bit more. So it's more seemingly mixed into the dressing. And our last step that we're going to do is actually we're going to squeeze, freshly squeezed orange juice that's going to go into our dressing here. So Megan is so kindly squeezing our oranges. We're using a whole orange here to get the juice. Again, this is going to also play off of that sweet part of this recipe and of this salad. So juicers like this one, especially with oranges, are really crucial to have in your kitchen. They make squeezing citrus, whether that be lime, lemon, or orange juice as we're doing today, very easy. And citrus is a wonderful way to add flavor without adding sodium to your food. All right, there we go, looks great. And then we're gonna pour it into our dressing. There you go. And then because we have it in a mason jar today, we can put the lid on it and shake it up. So it's nice and easy to do.
Make sure the lid on is nice and tight.
There we go. And that looks great. So now if we were gonna serve it a different day, we could keep the dressing separate and then pour it on, you know, as soon as we are gonna serve it. But today, for our viewing purposes here, we're gonna pour it all together, mix it up so you can see what it looks like. And that will be all for our salad, our black bean quinoa salad with citrus dressing. The citrus dressing also tastes very good on other salads. So if you wanted to use it with a green leafy salad at home, it just has a really good fresh taste to it, and it can be used with lots of different salads. This one it particularly tastes good with. So there it is. All right, well, hopefully you were able to pick up some tips on how to integrate more plant proteins into your meals today. Keep that sodium nice and low, you know, focus on reducing sources of saturated fat, dietary cholesterol, and increasing that fiber, really important. Thank you for joining us today.
Take care. Bye-bye.
Bye.
That was great. I think we should probably proceed now to Jennifer and have her go over her presentation with us. And then following that, we'll be available to answer some questions. Thanks. Jennifer?
Hi, everybody. I'm Jennifer Lenders, a yoga therapist in cardiac rehab here in Ann Arbor, Trinity Health. I'm going to share a video with you of an example of some of what we do in cardiac rehab here with patients. So give me a moment and I will share screen here. Good evening. I'm Jennifer Lenders. I'm a yoga therapist in cardiac rehab at Michigan Heart and Vascular. And I'm here tonight to share with you just a very brief practice of yoga therapy in cardiac rehab. So if you'd like to participate, just find a comfortable seat. Just kind of rest your hands in your lap. And maybe sit up a little bit taller in your spine. And take a moment just to kind of let any physical tensions that you can ease off. So maybe drop your shoulders a bit away from your ears. And just take a breath. Let your arms relax. Let your legs settle. And let your midsection or your abdomen become soft if you can. And take a moment just to notice between your shoulders and your ears. And if there's tension here. And notice between your collarbones and your chin. Tension or ease. And then notice from the base of your cranium, the base of your head, and down to your shoulder blades, if there's tension or ease here. And we're just going to take a breath and just see if we can just do some small movements and just notice this area as you might close your eyes and just start to circle the tip of your nose as if drawing a circle in space, just about the size of a quarter. And then slowly make that circle just a little bit larger. And gently exploring just places of tension, places of ease. Letting the jaw relax. Letting the neck and shoulders be passive. And you let that spiral just become about as large as your body feels comfortable today. So we start to ease off through the neck and the shoulders. Come back to a level chin. Pause. And maybe notice a little further down and between the shoulder blades, and maybe lift the hands and just do a gentle pulling back as if pulling back on some reins, and just gonna squeeze the shoulder blades gently in And as you exhale, just releasing the shoulder blades to neutral. And we'll do that a couple times, just a little stretch, just to give a stretch across the pectoral muscles, and then a release. And take another breath in to pull back on those reins and squeeze the shoulder blades gently, and release. And pause and rest. And just feel those sensations in your back and take a breath. Right? We're going to move into a little bit of a different sensation in the shoulder blades and just explore it and be curious about it. We'll lift the hands again and just point the thumbs inwards towards each other. And as we're breathing in, we'll just pause in this neutral place. And as you're exhaling, we're now going to separate the shoulder blades and push the thumbs away from the chest away from the thumbs. So we're kind of gently rounding that upper back. And then on the breath in, moving the thumbs back, lifting to a neutral place. You could just try that a couple times. See if you can release or explore what sensations are in the back, the shoulder blades, the spine, the neck. At a slow pace, and just be curious today. Exhaling out. And we'll come back and rest the hands, rest the jaw, the shoulders, and pause. Let's begin to notice your natural breathing now, just the pace, rate, rhythm of the inhalation to the exhalation, and see if we can just breathe through the nose. And see if we can keep our mouth gently closed and just notice our nasal breathing for a moment. Right, you might feel those very small sensations at the edge of the nostrils and into the airway. See if we can keep any of the breath from tightening in the shoulders, the neck, maybe the upper chest, and start to feel it low and slow in the belly. So we're going to place the hand right at the lower rib cage, upper abdomen area. And as you're breathing in, see if you can start to feel that soft belly expanding slowly, maybe 4 to 6 counts. Whatever, without strain as you're inhaling, and just kind of filling the belly into the hand so you feel that outward movement. And as you're exhaling, then we want to kind of draw the belly away from the hand gently, kind of hugging those muscles like a corset around our midsection. And continuing that practice of breathing in long and slow into the belly, expanding. As you're exhaling, you're gently drawing the abdominal wall in towards the spine and extending the exhalation, maybe the same number of counts as your inhale. Even longer if you can without strain. And maybe you find that there's a bit of gasp for wanting to breathe naturally. So pause, just breathe naturally for a moment. And see how you feel. Like do a little check-in, see if it's different than your natural breath. You might notice any response to if you're trying to trying to extend the inhalation or the exhalation longer, do you start to tense up in the neck and the shoulders? And can we leave this area passive and just breathe down into the belly? And taking it lightly without force. So I hope this practice helps lead you to a greater awareness of how you're breathing and just being light and without strain and reduced breathing into the belly for better health. Thank you.
Okay, thank you, Jennifer and Megan and Dr. Smith and Nona. I think we're ready to move on to our Q&A session. So we have a few questions in there already. If you would like to ask a question, you can type it into the Q&A feature. Again, that's at the bottom of your Zoom screen. And if you'd like to ask your question anonymously, you can do that as well. Just make sure you select that before you submit it. And only the hosts and the host of the webinar can see the question. So we will kick it right off. So we have a question about AFib. What causes AFib? Never had an issue before this year, and my echocardiogram and stress test were normal, so it shocked me to learn I had it. Also, what treatment is recommended? This is a female in her 70s.
I'm going to let Dr. Nona go ahead and answer these questions. I want to just introduce him. He's one of my colleagues at IHA Michigan Heart and has a very strong interest in preventative cardiology. So go ahead, Paul, take it away.
Thank you. Thank you very much. So in regards to atrial fibrillation, it's an abnormal heart rhythm issue. And usually when we think about atrial fibrillation, there's a couple of causes that we like to evaluate for. So clinically, I always look out for any type of thyroid disorders, any type of sleep apnea. I always look out for also any excessive caffeine or alcohol use. Oftentimes, we don't have a clear cause of atrial fibrillation. With the risk of atrial fibrillation there's always a risk of stroke with that abnormal heart rhythm. So we calculate a CHA2 VAS score to evaluate your risk of stroke, and usually put these patients on blood thinners. In addition to that, atrial fibrillation in itself can be somewhat symptomatic. So we often try to manage these patients and make sure their heart rate is not too high, as well as try to prevent the atrial fibrillation from reoccurring and try to maintain normal sinus rhythm. So there's really two parts of the atrial fibrillation. One is preventing a stroke, and two is trying to maintain that normal rhythm or prevent the atrial fibrillation from reoccurring. If you're a female in your 70s and you have other comorbidities, more likely that you'll have an elevated CHA2 VAS score, which would put you at a higher risk for a stroke. So you would be someone that should be on some sort of blood thinning agent, or talk to your cardiologist about alternatives, procedures that would be also preventative for a stroke in the setting of atrial fibrillation.
Okay. When mentioning exercise benefits, is it strictly cardio exercise, or are there heart health benefits to strength training? So
any type of physical activity to me has benefits. What I usually like to tell my patients is I usually recommend, 150 minutes of moderate intensity aerobic exercise and to do 2 to 3 days of strength training. I do think any type of physical activity has its benefits for the heart health. I don't think, you should focus strictly on aerobic or strictly on strength training. I think a combination of both type of therapies will be the most beneficial for building heart health and keeping you functionally active as we get older.
Okay, I know a lot of heavy cardio can probably be pretty intimidating to people who maybe haven't had like an exercise regimen their whole life. So it's nice to know that a brisk walk or swimming or things like that also count as part of the heart health.
Yeah, To be honest with you, I think we kind of have this mental picture that we have to go to the gym or we have to do something very impressive or have a lot of machinery. Really, all we need is just to stay active, So going for a walk, anything that just gets you moving. It doesn't have to be anything fancy. You don't have to start right away being aggressive. It's something you can build up to. But we all have the resources. We all have access to watch videos and exercise videos. If we're using Zoom, we can all take walks. So it doesn't have to be a fancy or elaborate production to stay active.
Perfect.
And remember that curves I showed you on those graphs, how the benefit occurs starts to occur at a relatively low level of activity, and then of course it is better with higher activity, but it plateaus out a bit. So like Dr. Nona says, just get started and don't focus too much on having to run any marathons at this point.
Okay. Next question is, can you have a too high amount of HDL? Also, should I be concerned about the fact I had a silent heart attack, and what follow-up, if any, should be done? So the first one is, can you have too high of an HDL? And
so HDL is typically considered the good cholesterol. So I wouldn't focus, too much on can you have too much high amount of HDL. As a clinical cardiologist, I usually target therapy and goals to the LDL, which is traditionally thought of as the bad cholesterol. So when I'm evaluating a patient, I look at their history. If they ever had a heart attack or if they ever had a stroke, my goal LDL for them would be 70. If they have not had a heart attack or have not had a stroke, my goal LDL for them would be 100. So that's how I manage patients. I don't know of any data to suggest that there's too high amounts of HDL or there's any negative effects of having an elevated HDL. In fact, there's some data to support that having an elevated HDL is somewhat cardioprotective. So if someone had a silent heart attack, usually what we say is, you should see a cardiologist for that. I would, like to understand more about what they mean by a silent heart attack. Was this diagnosed based on an ECG or an echocardiogram? But that's definitely something, if that's the concern, I would recommend a follow-up with a cardiologist to further discuss and possibly have some additional testing.
Is that something your primary care physician could find, or do you have to be seeing a cardiologist to know that that's happened?
So usually some people say they have a silent heart attack where they see some sort of abnormalities on ECG. But the real issue is, sometimes this is false information or true information. So usually they're referred to a cardiologist to determine if in fact they truly did have a silent heart attack. So usually you're correct in that the primary care doctor is the first to kind of acknowledge something is abnormal. And then it's usually followed up by the cardiologist to see what was the cause of this abnormality and if it's truly something that requires further intervention.
Okay. We have a couple questions on plant-based diets. So one is wondering if IHA has further information on plant-based diets. So we have this group who focuses on lifestyle changes, but we also have our lifestyle medicine providers who live and work in the primary care world. So I would say, correct me if I'm wrong, doctors, but I would say there may be more in the preventative world, or, kind of when you're at the brink of a type 2 diabetes, where your team gets involved once you've had some sort of a health emergency, something along those lines. Does that sound like a good way to describe the two different specialties?
Well, we have a very strong, we're fortunate here that we at Trinity that we have a very, very strong interest in preventative lifestyle medicine, preventative cardiology, but also preventative lifestyle medicine for treatment of diabetes, hypertension, even eye issues, and just a whole spectrum of things. And I mentioned earlier that the American College of Lifestyle Medicine is a formal organization, and you get board certified practitioners. And I think it was the last one there on the link I showed you at the end of my slides, can get you to the place where you can actually request a lifestyle medicine consultation. Or of course, you can have your primary care physician refer you to one of those providers as well, if he or she would like you to have the more expertise type interventions there. I strongly recommend it for anybody with any type of health issues, because it just is so widespread. It can help with cancer. It can help with everything: hypertension, diabetes, go on and on. All those 7 risk factors that I showed you in the slides. So we have a pretty robust program here, quite a bit ahead of a lot of the other institutions in the country and in Michigan.
Excellent. And I will provide some additional links in the email that will follow up. So we'll include the links that you shared, Dr. Smith, and then I'll also include some of our lifestyle medicine contacts within IHA Medical Group. Okay, next question. I have increased my water intake during the day, but it still interrupts my sleep at night. Any suggestions on increasing my sleep while still getting my proper water intake?
That's a tough one. There's always some lifestyle changes in terms of, when you stop drinking the water. I assume you're having some issues with bladder control through the night in regards to water intake. There's some things that we can, look into in terms of when we stop drinking, as well as medications, to see if any of the medications might be causing, excessive urination. But there's also some medications that might help prevent, any type of issues if you're having excessive urinating during the night. I would probably direct that more to the primary care doctor to see, and to try and go through the medications and see if you qualify. Because sometimes, medications may cause some of these issues throughout the night. And if an eliminated medication can help, that's probably where I would start.
Okay. This is a question possibly for Jennifer. Does massage help as well as yoga?
Any one of the things that yoga helps with is the reduced tension in the body. And when we reduce the muscle tension, we help to reduce overall stress response in the body. So reducing that muscle tension in other ways, such as massage, I would say is a great way to do it if that's an option for you.
Okay. And for Megan, is oatmeal equal to quinoa?
And the answer to that is yes, but it's not that simple. So I just want to make sure that oatmeal is considered a whole grain category, just like quinoa is, but please make sure your oatmeal is not the instant packets, because that contains a lot of high sodium, added sugars. Again, those are pro-inflammatory factors that cause your risk of heart disease there. So please make sure it's either the rolled oats or the steel cup version.
Okay. Seems like steel cut would be a better substitute for quinoa, in my opinion. Okay. Let's see. This person says, I've struggled with sleep for years. My primary care physician prescribed medication to help. However, it caused nightmares that prevent me from falling back asleep. I feel stuck. Any suggestions?
Yeah, so first I would, do a thorough assessment of your sleep hygiene. Make sure you are, having some appropriate sleep habits. To also have you be evaluated for sleep apnea if you qualify and you have certain conditions. I think oftentimes sleep issues are related to underdiagnosed sleep apnea. And in terms of medications, for my patients, I typically try to avoid all medications for sleep unless it's a last resort. I usually have patients try initially melatonin at a higher dose, usually 10 milligrams, and see if that helps. And then doing good sleep hygiene as well as evaluating for sleep apnea. Anecdotally, I found that some of these sleep agents have significant side effects and are not well tolerated.
Okay. And I know, Dr. Smith, in your presentation, you talked about putting your phone away, not looking at the TV or a screen leading up to bedtime.
Right. I think, again, that book that I recommended does address that same question, just like and has the same answer as Dr. Nona has, it's not recommended that that be used. And it may be helpful to the individual who asked that question to take a look at that book, because he also offers what I offered, but in a lot more depth. And maybe there's something that will resonate with that individual that will help them.
Okay. Does alcohol consumption affect CKD more so than CHD? And I'm not sure what those mean.
I believe CKD is referring to chronic kidney disease.
Okay.
CHD, as far as I know, would be congenital heart disease. I'm not sure if the Aster had another issue, but definitely you have chronic kidney disease, you would want to limit your alcohol consumption. I don't know if I would compare CKD to CHD if the question was congenital heart disease, or if there was some type of miscommunication, or if they wanted something other clarification.
So I'm wondering if maybe the question is, how does alcohol affect heart disease? I mean, I imagine it's
So I think we all have our own vices. I think anything. I like to think everything in moderation. So, if you look at the research on alcohol consumption, there's some data to support red wine consumption. There's some data to support absolutely no alcohol cessation. I like to say everything in moderation. So 1 to 2 alcoholic beverages is okay, but everything with moderation. Usually we like to evaluate patients in terms of how much they're consuming and what type of beverages they're consuming. I don't think there's any absolute contraindication to avoid all alcohol. At least that's what I tell my patients if they have heart disease.
okay. And this person's actually asking another person if wine will help lower their HDL.
So HDL is good cholesterol.
Yeah.
So you probably wouldn't want to lower it. I see the number they reference is 280, which I'm guessing 280 is their total cholesterol. And there's some data that wine will help lower cholesterol. That would be my main motivation for drinking wine. But it will lower it. If it will lower it significantly to be where you need to hit your target goal, I don't think it'll be significant enough, but it should help a little bit.
Okay.
I would just add, I agree with everything Dr. Nona said. It's moderation is best. There've been a lot of studies that are more and more being done that suggest that probably it's okay, that you probably don't get into trouble from the alcohol until you get to the higher alcohol consumption. There was a 2022 study that looked at tons and tons of patients and basically found that the curve where the risk goes up kind of started at about 15 drinks per week. Now per week, okay, not per day. 15 drinks per week. So you can do the math there and figure that's about 2 drinks, or thereabouts. And that its curve was exponential. So once you start moving up there, the risk dramatically starts to increase. So I agree with what Dr. Nona said. In moderation, when you're on the low part of that curve, you're probably okay. But again, time will tell. There's more and more research being done on that. We'll have to see how that changes over the next several years.
Okay. And does wine have the same effect as something like a massage, where it kind of causes a relaxing feeling, or is it something that's actually in the wine and the alcohol that is beneficial?
So the thought process would be that the wine contains some antioxidants, not so much that the anti-I guess anxiety or the social effects of alcohol will be. It's more the antioxidants. The effect of wine has some cardiac protective effects.
Okay, so Dr. Smith, you talked about the implications of skipping breakfast and the increased risk of stroke. So does that study account for cigarette and caffeine use instead of breakfast? So you're not just skipping breakfast, but you're actually replacing it with coffee or caffeine in a cigarette.
Yeah, they did try to control for those variables. So it was they tried to do what they call a matching. So they try to compare basically apples to apples, so that you try to compare people that, just skip breakfast, and then look at the ones that have no other risk factors and compare that group, and then look at the ones that skip breakfast and had a cigarette and compare that group. So they did try to match the people together. So no, it's not just a substitution effect that I'm having a cigarette instead of oatmeal. It really is an effect of actually missing the breakfast. And there's lots of theories that we could go into on why that is, but it's really an accurate representation.
Okay. And this person was wondering who conducted that study. Do you know that?
Yeah, I can get the reference here in just a
Okay.
second. I don't want to interrupt. I'll go ahead and
Okay.
let you go on to something else here
Okay.
right now, and then I'll find it
come
for you.
back to that. Okay, so someone is asking about Tai Chi. They're a 48-year-old female, and they're wondering if it has the same benefits as yoga. And I guess I would throw in there Pilates, and there's other exercise that's sort of along the same lines. I don't know, Jennifer, if you want to take that one.
Sure. So, part of what we're doing with the yoga is really building a muscle of body awareness and breath awareness, and just being able to check in with ourselves and notice, our own body sensations, asking the question, what does my body need right now? Does it need more rest? Does it need more activity? So building that muscle of checking in. And some Tai Chi is mindful movement, just like yoga. It's also mindful of the breath. And so it would be a great alternative practice to practice that, checking in with yourself. Incorporating movement with breath helps us to really come back to our body. A lot of times we can kind of leave the body, disconnect from it, not listen to its messages. And so we're just building that practice. So yeah, I think good alternatives.
Okay. And I would say that the techniques that you used in the video, I would imagine would help if you're trying to fall asleep as well. There are different meditations and things you can go through.
Yeah, we definitely do. We do a workshop here too on healthy sleep for a healthy heart, and incorporate all the ideas about how to get back to sleep using stress reducing techniques and practices using the breath.
Yes, and I imagine you don't actually go to patients' houses and soothe them to sleep. So I personally have used the Calm app or Headspace. There are a lot of apps out there that really have good resources for some of those meditations. Do you have any that you really enjoy?
Insight Timer is one that I use. It has, hundreds of thousands of meditations, sleep, NSDR, which is non-sleep deep rest. It's a guided, deeper relaxation technique, and Insight Timer's good. Calm. There's a number of them out there that are good.
Okay, I will share a few of those in our follow-up email, and I think you can also find some meditation on YouTube as well, and that doesn't come with that monthly cost if that's a concern.
Right.
Do you have patients that you encourage to actually limit exercise? So this person, it looks like they had an intensive aortic aneurysm, and they're wondering, can they exercise? Can they dance? Or is there anything that they need to be careful?
Yeah, so for patients with aortic aneurysms, I would definitely encourage to stay active, definitely with aerobic activity. The thought process is that any type of excessive force in the thoracic area can worsen it. So you'd want to talk to your doctor about, any type of bench pressing or heavy type of pressure on the chest. but aerobic activity should be fine. With these patients, we typically like to have their heart rate and blood pressure controlled. So it's something that I would say would be okay, but you should be monitored, and check in with, a cardiologist and a specialist.
Okay, so movement is better than no movement, and you just have to sort of tailor it if you have some special circumstances.
Correct.
Yes, we screen, for people that, for example, come into cardiac rehab. We screen them pretty carefully, and there are a few reasons not to exercise. Certainly, if you have unstable angina, if you have a expanding aortic aneurysm, as Dr. Nona mentioned, if you have severe valve disease, especially one called aortic valve narrowing, aortic stenosis, things of that nature. But by and large, that does not mean that just because you carry that diagnosis, you can't exercise. It really has to be determined whether your condition is stable, and that has to be really at the level of either your primary care physician, or if there's any question, a cardiologist.
Okay. Someone is asking about mystery bruises. So they have 2 stents, and they say they have bruises on their thighs all the time, even though they haven't injured themselves.
Yeah, so when you have stents, you're usually placed on something called antiplatelet therapy. One of them is usually aspirin, and there's usually a second medication, usually either Plavix, Brilinta, or Prasugrel. So those medications cause the platelets, which help with bruising, not be effective, because we want to keep that stent open. And that's oftentimes why you see bruises on your thighs. Usually it happens if there's no inciting trauma. So you can see that. So that would be a normal kind of side effect of the medication that are used to keep the stent open.
Okay. Okay, it appears I have, is it bradycardia? Is this something you'd see a cardiologist for?
Yeah, so bradycardia is just a word for slow heart rate. So I think it would depend, one is how slow the heart rate is. 2 is the patient is symptomatic. Usually with bradycardia, we worry about lightheadedness, passing out, feeling dizzy. If you do have those symptoms and you do have a slow heart rate, it may be something where you need to be monitored to make sure you don't have any dangerous arrhythmia. If someone is very trained in terms of or athletics or a marathon runner, the heart kind of compensates and has a slow resting heart rate, and that would be a different condition. So it all depends on how slow the heart rate is and what symptoms you're having.
Okay. So this person says they have a pain, which seems to be in the carotid artery area, and they've been getting headaches lately. Would love to hear your thoughts on where to start. My primary care doctor said nothing is wrong, but I feel uneasy. There were no tests done as of now.
Yeah, so that's a good question. One thing I would definitely do is, perform a good physical exam on that patient and listen for what we call bruits. That could sometimes suggest that there might be a blockage in the carotid arteries. And if there is anything abnormal, I would probably order a carotid scan, an ultrasound. It's a non-invasive scan to make sure that there's no type of abnormalities in that carotid area. So those would be my initial thought process, would be a good physical exam to make sure there's no type of abnormalities of the arteries, as well as to make sure that there's no damage in terms of blood flow, if there's anything abnormal.
And if you are feeling like you'd like to have a cardiologist, give you a physical, is that something you can request from your primary care physician?
Yeah, it's I think it's dependent on insurance. Some insurance requires a referral to a cardiologist, while some insurances allow you to go ahead and see a cardiologist directly.
Okay, and
So I would clarify that, but sorry, go ahead.
No, I'm sorry, Dr. Nona. I was just going to say that's something that typically our front desk staff are very well versed in. So if you have questions about your insurance coverage, especially around cardiology, you can reach out and talk with them. Okay. Someone's asking about how about hot tub for aortic aneurysm?
I wouldn't see a reason not to hot tub if I had an aortic aneurysm. I don't think it's not help the aortic aneurysm, but I wouldn't see a reason to not go to hot tub.
Can vigorous exercise make a difference with calcium deposits around the heart? Can it reduce them?
So that's a good question. So I assume someone was referring to coronary artery calcification. So basically, that's a sign of advanced plaque in the arteries. You know, with exercise, we're aiming to really stabilize the plaque and prevent more from developing. You might get a modest reduction. By modest, I'm saying 5 to 10%. But in terms of completely having coronary artery calcifications go away, it's very unlikely. So the main goal is to stabilize the coronary calcifications and prevent further plaque development, and exercise helps accomplish that.
Okay. Is there any risk to vigorous exercise if you have calcium around your heart?
There shouldn't be any risk as long as you're not having symptoms while exercising. So, people with calcium around the coronary arteries are at a higher risk for heart disease. So you just want to be very vigilant if you notice any symptoms of chest pain or shortness of breath with heavy exertion.
Okay, and that sounds like it could be true for anyone, even if you don't have calcium around your heart.
That's true. That's true.
Okay, and someone is asking about, do smoothies count as breakfast? Megan, do you want to answer that one?
Yes, I can. And so biggest thing there, it depends, honestly, what is in it. Kind of thinking about when you're having a meal, really making sure you have certain food groups, so protein, fat, fiber, whenever possible, and also carbohydrates. Those generally help really maintain stability, satiety, good blood sugar levels throughout the day, and also good energy levels. So to me, if it's just fruit and water, that's not enough. Make sure you have all of those components in your smoothie moving forward.
Do you have a favorite, well, obviously you have fruit, veggies, and things along those lines, but is there like a yogurt that you like to use as a base?
I do. I always love to recommend, I personally eat this every day too, the Oikos 000. And that is a great blend. And it's nice too that it has 3 different reasons why it's the 000. First is it doesn't have any artificial sweeteners in there. So we really want to stay away from the Splenda, Equal, anything that's manufactured, and making sure it's plant-based, natural. Stevia is what it's made with, so there's no sugar there. And then it's 0% milk fat and no added sugars. So that's my favorite one to do. They have a lot of different blends, and it doesn't have to be the plain. And it has 15 grams of protein. And even now they have 20. So either or is fine to do.
Wow, that's encouraging, because a lot of times the protein powders can kind of change the flavor, or they're not as delicious as some of the other things that can go into a smoothie. So it's nice that you can wrap it into the yogurt. Okay. If an old stroke was seen on a scan, should I be worried? So it sounds like maybe a stroke they had in the past but weren't aware of.
So if someone has an old stroke, definitely I would have that patient evaluated. We want to screen for why they had an old stroke. So we would look at where the stroke was located. And we always want to be vigilant on why people are having strokes. So as a cardiologist, we worry about cardiac sources of stroke. So we evaluate patients for atrial fibrillation or other arrhythmias that may cause stroke. We also evaluate them for plaque buildup in the carotid arteries. So I would encourage anyone who's had an old stroke to talk to their primary care doctor and definitely be seen by a cardiologist to help distinguish what type of stroke they had and if they require additional investigation into the stroke etiology.
Okay. Do you have a recommendation for the best sleeping position for your heart?
I'm not sure if there's any data on the best sleeping position for your heart. I don't know if Dr. Smith has any comments on that, but I'm not
No,
aware
I
of
don't. I
anything.
don't have any
Mm.
I don't have any insight on that. I mean, there certainly may be issues if you have, a mechanical, as Dr. Noah said, mechanical obstructive sleep apnea in terms of certain positions of your neck and your chest in that area. But I'm not aware that there's been any hard data showing on that. I will say that if some people have difficulty sleeping, for example, the ones that have what we call congestive heart failure, that is to say they can accumulate fluid, they often have to be in a more upright position as opposed to a supine position. But if the question is, side, back type thing, I don't have any hard data that I'm aware of on that.
Okay. I just have a couple more questions if you're okay to stay on for another couple.
Mm-hmm.
Okay, perfect. So this person's asking, is it true that eating eggs several times a week is bad for heart health? So no, they go back and forth. Eggs are good and then they're bad. So just curious, what is the truth on that?
Yeah, so I think the thought process is eggs are one foods that are a little bit higher in cholesterol and can elevate cholesterol. So as kind of said before, I think one of the truths in life is everything in moderation. So eggs are known to have high cholesterol. There are alternatives. There's egg whites. There's also alternative type of egg supplements. So I would encourage them to look for alternatives. I wouldn't say to avoid eggs altogether, but I wouldn't say having eggs every day for breakfast would be a heart healthy diet.
Okay. Megan, do you want to add on to that or kind of give any of your top recommended breakfast ideas?
So normally what I tell my patients, there's definitely been studies shown that the whole egg isn't really related or correlated with dietary cholesterol necessarily. To me, all the nutrients are actually in the egg yolk. And when you take that away, there's no nutritional benefit there. And so it's not saying that we need to overdo it. Again, I'm not going to tell you to do 10 in a week. So if you were to do them every single day, what I recommend is doing one egg white and one whole egg together. So therefore, you're not getting that saturated fat from both. You're just doing it from one source. Because to me, it's still good for you. But again, we're still watching that saturated fat content and not doing both whole eggs each day. So that's how I do that.
Okay, that's a great suggestion. Okay, and then this person says they were just diagnosed with a heart murmur. Can you briefly describe what causes that?
Sure. So a heart murmur is just a fancy word for an abnormal heart sound when you listen to the heart. And if you think about it, a good example would be when we are out in the garden and we're, putting a hose on plants and we put our hand on the hose and the water flows out a little bit faster, that creates a noise. And that's what is referred to as a heart murmur. So a heart murmur usually is representative of accelerated blood flow. And some of the causes of that could be some damage to the valves. So every time we hear a heart murmur or we hear a heart murmur on physical exam, we get concerned that this may represent some cardiac valve issues. Because if the cardiac valve is tight, the blood may be flowing fast, causing a murmur, or the valve may be leaky. So we usually evaluate this with an ultrasound of the heart. A lot of people have heart murmurs because they have fast blood flow to the heart, and we call this innocent flow murmurs. So that's what we're trying to distinguish by evaluating with the ultrasound of the heart.
Okay, and then there's one last question. This person says they have multiple systemic issues, including diabetes, AFib, and CAD. They said that they had a watch been inserted and a cardiac stent. They're in their 70s. They're having some difficulty coordinating all the issues. She says she has the X factor, which I assume you understand. It says that allows triglycerides to rise and fall slightly. I take many medications and recently have started passing out and falling. Could my medications be related, or are one of my physical ailments causing this passing out? EEG was negative. So she's wondering, who could she see to start investigating this?
Yes, that's a great question. So it seems like there's a lot of issues going on. The passing out, very much concerns me. So I would want to make, sure that one, that this wouldn't be related to over aggressive blood pressure medications. And that two, that there's no, heart rhythm issues with the atrial fibrillation or any type of slow heart rate that's causing the passing out. So I think definitely ruling out cardiac causes. Sometimes we do other testing to determine etiology of what we call syncope, which is, passing out or loss of consciousness. So it seems like they had a workup to see for neurologic, but, passing out can represent something serious. So I would definitely do a thorough investigation of the patient's medications. I'd have them see their primary care doctor and their cardiologist, maybe even seeing, blood pressures while seated, while standing, to see if there's any change in the blood pressure. And if that's contributing, we usually call that orthostatic vitals. So that's definitely where I would start, and definitely evaluating for any type of what we call conduction disease that may be causing patients to pass out or a slow heart rate.
Okay, so it sounds like your primary care physician is the best place to start in that case. Okay. All right, I think we covered all of the questions, or at least most of the topics here. So this is an incredible program that all of you support, and I just am always blown away during these presentations by the resources that cardiac patients have at Trinity Health. So if this is something you're interested in, we will share contact information as well as some of the lifestyle information that's available, or the lifestyle services, the lifestyle medicine services that are available through IHA Medical Group. And also our the Michigan Heart locations. We'll share those as well. So thank you all for presenting, for being
here. Will, Allison, I didn't mean to interrupt, but that last question about the breakfast was in the Journal of American College of Cardiology.
Oh, yes.
Journal of American College of Cardiology, 2019. And that's the source. If they want to actually know the volume, it's 73 and issue 16. So if they want to go back and look at.
Thank you for reminding me. I definitely forgot about that resource. Thank you, Dr. Smith.
And the people were matched, as I said, by the way. So thanks. Sorry to interrupt there.
No, that's great. Thank you. I appreciate it. That's an incredible statistic. Okay, so I want to thank all of you for being here, both to observe and for presenting. You guys did a wonderful job. And this is such an incredible program again, and I'm so grateful that all of you are part of it and taking care of our patients out there. So thank you so much.